Leah, uthi ngipress ku-play volume kwase kwenzeka kanjani?
There's great lighting.
There's great more lighter notes phela kumele ngismile manje kodwa ke akuthi sengismile cerebral palsy. Hi guys, welcome back to my YouTube channel. Today we are talking about a topic that is also important and impactful. I know I've been saying that a lot, but really we are talking about the cerebral palsy. If you do not know what that is, trust me, I got you. So I got your back. Let's explore what cerebral palsy is, the signs to look out for, as well as the crucial intervention process for someone who's been diagnosed with cerebral palsy. So what exactly is cerebral palsy now? It's a group of permanent movement disorders that appear in early childhood. These disorders affect muscle coordination and body movement, often caused by the damage to the developing brain, either during birth or after birth or during the birthing process. So what happens is, most parents will say to me, Zama, my child didn't crawl at 6 months, not 6 months. My child didn't sit at 6 months. They didn't crawl at 12 months. They didn't crawl at 11 months or 8 months or 9 months. I have a whole video about crawling and what the norms of crawling, how to see normal development crawling, how the children actually develop in crawling. But a child with cerebral palsy, as it affects movement. So our brain controls all our muscle movement. In fact, our brain controls everything. When your brain is gone, guys, nothing can be done. So these children, when they have a lesion, or like a parent says they drowned at the pool, and then the brain didn't have enough oxygen there was not enough oxygen to the brain, and therefore the child was rushed, had oxygen, everything was fine. But after some time, then the parent says that, they are not now meeting their developmental milestones as the normal developing children. Or a child has a traumatic brain injury, they are in a car accident, something happens to their brain, maybe like they banged their head and they banged their head back, that type of injury, and then something happens to their brain, and therefore their brain that controls their ability to crawl, to move, to pull up, to stand, then the child cannot do that. Cerebral palsy is also permanent in terms of it doesn't get healed. But what happens is that as the child grows, other parents may say to me, I think she's becoming better, or I think she's becoming, she's growing out of their cerebral palsy. And my answer during a counseling session or during is that as some of the children develop, they learn a coping mechanism, or they also learn other skills, which then may mask some of their weakness. So these disorders affect the coordination of body movement. Right. So some children or adults with cerebral palsy will be able to move, but the way they are moving, their gait, they will be moving maybe like in a shaking manner. They are ataxic, but I will not bore you with the types of CP in this video. You get your spastic, your ataxia, your hypertonia, the rest. And a child with CP, similar to autism, nakona, I might call it something of a spectrum, but meaning that also no children diagnosed with the same type of CP are going to be affected the same way. Some may have quad CP, meaning all their 4 limbs are affected. Some may be just like a hemiplegia, just half of their side are affected. Some may walk, but the muscle tone is affected. But the physios can give more details about it. For me, I'm concerned with cerebral palsy. Can they speak or can they communicate from using AACs? I have a whole video on how we use AAC to communicate. 2, are they feeding safely? Or maybe let me put that safety of feeding is the first concern. If the CP is severe, they might even need like peg feeding, meaning they will have an operation where they will have a hole on their stomach if they are not safe for oral feeding, but that's normally the last resort after we've assessed their safety to feed, not only from a bedside manner, but also with something like a modified barium swallow or another objective measure. Then once all of those are done, I'll then say, oh, this, and we've tried all the consistencies, we've tried all the positioning to see which position is safe for eating. If all that does not work, then the child might need an operation for non-oral feed. Initially, they might be on an NG tube when they are like young kids, or if they are crucial at hospital. And after that, we might move to something more permanent, like a PEG, which is a percutaneous intergastro but I will not bore you with those details. If you want me to do a video on PEG feeding or that type of video that explains about the non-oral feeding, I will go into it next time. So how do you spot the early signs of CP? Because early intervention is quite crucial. Parents and caregivers should be vigilant about developmental milestone. I did a video about how you can use your Road to Health chart, ikhadi lakho lomgomo, to actually check the milestones if your child is meeting those milestones. Currently, when you are taking your child for vaccination, they check that, but also parents, do not doubt your instinct. If the people do not check it, please, you check it for yourself and then report if you feel like there is a delay during your vaccinations, and ask if you could be booked for speechy or OT or physio, depending on the delays, because in that Road to Health chart, it tells you that if there's delay on communication, hearing, you need a speech and audio. If there's delay in movement, you need a physio. If there's delay in movement, you need a physio and OT. If there's delay in teeth, you need a dentist. If your child is underweight, you need like intervention from a dietitian. So all of that information is in that video where I said, how do you use your Road to Health chart to detect if your child has a disability? Okay, so these signs include delays in motor skills, difficulty with muscle control, difficulty with abnormal reflexes. We all have reflexes. Reflexes protect us. In fact, all of our kids are born with reflexes. Even us as adults, if someone hits your knee, you flinch down. That is a reflex. It's a protective mechanism. If you place a child on your boob, the reflex is to suck, or a rooting reflex, they will turn around. But children with CP, normally they do not outgrow the reflexes. And that is why sometimes when we are doing intervention, I would say, do not use a plastic spoon with the child or on a CP, because they might still retain their bite reflex. And when they are eating maybe with a metal spoon or a plastic spoon, they might bite through it, and then it might hurt their teeth or end up like breaking and hurting their mouth. So that is why when we are doing intervention, I might like, oh, this is the type of spoon that we are using for this child. That comes from that assessment to say they still have a biting reflex. This is the spoon that we can use to actually, and this is the side you need to feed the child in, so that we can minimize the child using their reflexes. So it is important to remember that early intervention can make a world of difference. So if you notice any of these signs about your child development, do not hesitate to contact the health professionals. They conduct the assessments and provide guidance tailored to your child's need. Like I say, a child with ECP might just need trunk control. Others may not be able to sit, may not be able to roll, may not be able to walk. So early intervention will help to facilitate those. Today I was at a center where the caregiver said, this child is a bit floppy. We did the assessment and we're like, yes, there is tone involved, but this child can still pull their head up to stand. So these are some of the functional activities that you can use. Maybe put a wedge. If you don't have a wedge in the house, like using something like a blanket, putting the child over the blanket so that they could try and use their neck, and then put the toys in front of them so that they can be motivated to reach out. So depending on what skill the child or what barrier the child presents with, that's when we'll tailor our intervention. First, we'll do the assessment. Mostly in the government hospitals, we run clinics such as high-risk register clinic. So if your child had prolonged labor or premature birth, we will monitor those children. If you had that event happen in your life when you were giving birth and it was a traumatic birth and you were never followed up, or you that happened in KZN and now you are in Joburg, please just go to a clinic, get your child checked out during immunization, explain, maybe if you still have records of what happened there, have them when you visit on your next clinic visit, so that health professionals could be able to carry over the treatment and could be able to assess, because when you are placed on the high risk register, it means that your child is at risk for developing other or having developmental delays. So when we say we'll monitor you after 6 months, we are trying to figure out after 6 months, do they meet the milestones? Are they sitting? Are they doing this? Are they eating? So that later we know we can early detect, for instance, is this child hearing? Because the child had meningitis. Meningitis places children at risk for a hearing loss. This child was prem. The child gets placed at a high risk register because prematurity or prolonged labor or all these conditions place your child at risk for other disabilities. So it is important to follow up, especially if you've had a traumatic birth or you had other birth complications during your child's birthing process. So now let's talk about the intervention process. Once the diagnosis has been confirmed, a multidisciplinary team comes together to create the treatment plan. The team may include your pediatricians, your physiotherapists, your OTs, your speeches, and your dietitian, depending on your child's case. There are schools, guys, for children with physical disabilities. Some children with physical disabilities have above normal IQs. I have children that have gone from grade RR to grade 12. I'm excited for them. Like one of them recently posted a picture and he had his own car. Awuyazi excitement yami, guys. Awuyazi excitement yami. I literally wanted to have a microphone to say, Sbanbani, please tell everybody what happens when a child with CP is supported. And I'm speaking because this person has CP and they finished their grade 12. They didn't endorse grade 12. They were able to access some of the learnership programs. There are a lot of learnership programs that are looking for children with disabilities or adults with disabilities so that they could be placed in places of employment, because South Africa is probably we are sitting at 50% or 40% unemployment, depending on how we classify employment, whether structural. Yes, I'll go into those details some other time. But with disability, if we are 50%, there's probably 60% of people with disability who are unemployed, and I could tell you that that number is quite high. That's an estimate. And having worked with people with disabilities for over 7 years, 8 years, I can tell you that that's my biggest worry. So if you're a company out there that places or that is in need of learners with disabilities, please call, come. We'll be able to assist you with ensuring that you find your disabled candidate and will support them with what type of support they're gonna need so that they could be productive in your company. So treatment options vary depending on the severity of the symptoms, individual need. Physical therapy focuses on improving movement and mobility, while OT focuses, or occupational therapies focuses on everyday tasks. Speech may be beneficial for those experiencing speech or swallowing difficulties. That is why I said the treatment will depend, and whoever the profession that will get involved, it will be dependent on your child's difficulties. Additionally, there are assistive devices such as braces, walkers, communication aids such as your laptop, such as your TT Snapco that we spoke about on that video of what type of assistive devices are available for people with communication difficulties. They could be recommended for your child. So other people might need just a walker, Others might need a whole wheelchair. There are electronic wheelchairs now that help our children be more mobile. I loved it at my school. Because they will call their cars by name. They'll be like, "Yay, I'm riding Goslahla because now I'm," it's so nice to see confidence being restored in a child. And sometimes our children, especially those with muscular dystrophy, which is a neuromotor condition, where they lose the function over time. They lose their motor function over time, and their muscles become weaker and weaker. When they get into having an electronic wheelchair, then you see the confidence that you have never seen, because more now they've become independent. They're able to go to places by themselves. They're able to go take things by themselves. So, but their batteries for these wheelchairs are expensive. These wheelchairs range from 50,000, 20,000, 30,000. So we need everyone to come to board to assist where they can, to ensure that our children get the assistive devices that they need. Not only assistive devices. I may be speaking and you are a company out there and you're thinking, how can we give back as a company? Mine would be, if you want to give to a school that has got disabled children, before you could bulk buy the wheelchairs, please consult the schools. Most schools for disabilities in Gauteng and in other provinces, they have therapists on site who have assessed the kids, who know what type of wheelchair that these children need, because a wheelchair is not a one size fit all. They have to make sure that this wheelchair, if it's an electronic wheelchair, does the size, how do they need to operate this wheelchair? Are they going to operate it? Some of our children, they have such contractures and such barriers that they cannot maybe use their hands to navigate their wheelchair. They may need the one that they're gonna blow into and then it moves. So please consult the schools, please contact your district, please consult anyone who specializes. One of the evaluators who came to evaluate us said, the therapists are scarce skills. You may not find them everywhere, but if you consult your department office in health, in education, just if you inbox me on Facebook, on TikTok, wherever, we will be more than willing to help, because at the end of the day, we understand our kids and we want what is best for our kids. So there you have it, guys. I was providing a brief overview of what CP is, what early signs, what intervention process. So if you suspect that your child may have CP, or if you are seeking support, don't hesitate to reach out to healthcare professionals. Thank you so much for watching this video. And if you found this video helpful, be sure to give it a thumbs up. Subscribe and like and share it with other people. Together, let's spread awareness and support for those affected by cerebral palsy. Until the next video, continue advocating, guys. Continue advocating for inclusivity from our churches. Continue advocating for inclusivity at our workspaces. For now, it's a bye from me. Thank you so much for supporting me on this journey. Peace out.